Missouri is a largely rural state, and so we have quite a variety of hospitals within our state. We have hospitals that are very, very small. Some of them have a census of 2 to 3 patients a day at the most, and some of them have hundreds and hundreds. And so the level of capability is varied among our hospitals. Through the Hospital Engagement Network, we've been able to provide education and training for meeting the needs of the hospitals wherever they are, whatever their experience and expertise is.
That's fine.
The real key to the success in the HEN is really the non-competitive nature among hospitals. This is an area where they shouldn't be competing, and this is not an area where they think they ought to be competing with one another when they share best results, when they try to drive improvement.
That actually may be a better view than what we had.
That's been the success, and it came almost day one when we had our group meetings.
What's the most important thing?
Certainly the challenges that we all have in healthcare are related to doing better, having better clinical outcomes with less reimbursement. It's not about doing more with less, it's really about doing better with less.
And then the primary contacts will get this exact same.
At the Missouri Hospital Engagement Network, we've used a kind of a unique approach. For the first year, our plan was to build those building blocks with hospitals to give them the skills that they need. And we provided that through state meetings, webinars, individual coaching calls with hospitals, site visits, so that we could actually bring the learning as close to them, but also allow them the opportunity to learn from each other.
So you just have to check all these, don't you?
This year, our focus has been more on taking the learnings right into the hospitals themselves. And so we've had regional meetings instead of statewide meetings, and that's allowed the hospitals to bring people to the table that normally have never had a chance to come to the table and talk about quality, share ideas and innovations with each other.
Just relax your arm for me.
Our staff closest to delivering the care are in the best position to make changes that allow them to do their jobs in a way that is going to be safe, is going to provide consistent care.
120/60.
And so having them be the ones to have the question on the web repository, if it's coming from a staff nurse to a staff nurse in another organization, what a powerful tool that they can own that and feel accountable for actually taking an idea, sharing it with their team, and having it come from within the team and having it come top down or from a director or from a nursing leader.
And I think she is a fall risk as well.
We're excited about some of the achievements we've had here in Missouri. Harm from hospital-acquired infections have been reduced by 30%. Readmissions have been reduced by more than 15%. And for early elective deliveries, every one of our hospitals in our HEN that did labor and delivery have adopted a hard stop policy. All those are meaningful, all of those are actionable. It really is an embrace of the AAA. Better care, better health, lower costs for the people in this state.
Thanks for tuning in to HN Daily's special coverage of the Health Research and Educational Trust's Hospital Engagement Network. This project has been brought to you by the Center for Medicare and Medicaid Innovation, the Partnership for Patients Initiative, the American Hospital Association, and the Health Research and Educational Trust.